Blindness is one of the neglected problems in global health, but it's also one of the few big problems that we can win. There are currently 18 million people on our planet who are suffering in total blindness, who could have perfect sight restored with cataract surgery. Blindness is one of the largest impediments to progress in the poorest communities. It's a huge burden and devastating not just to the individual, but to their family and to the whole community. Blindness will take a child out of school or an able-bodied person out of the workforce to care for the blind person. From the first time I saw the miracle of cataract surgery on a totally blind patient, I realized that there's nothing else I can think of in the realm of medicine that is as cost-effective that we can do and actually really change lives instantaneously. The Himalayan Cataract Project is a program I started with Sandak Ruit, who's a Nepali ophthalmologist. The least expensive lens implant in 1990 was over $200. And in cataract surgery, we put a little lens implant in that focuses the light. So Dr. Ruit started a lens factory to manufacture these intraocular lenses in Nepal. And with local manufacturing, we've now been able to bring the cost of an individual cataract surgery down under $25. When we started, there was a backlog of 250,000 people who were blind from cataract. So we thought it would be a lifetime before we could get a handle on the cataract problem in Nepal. Well, 20 years later, Nepal is one of the few countries in the world that has reversed its rate of blindness, and we've evolved into a world eye care development program and working all over Asia and focusing a lot on Africa. We're going to be putting everything in place for a cascading effect to create a planet where no one is needlessly blind. We were really going to be developing systems and putting systems in place, and in the process, through our training, we'll be restoring sight to 500,000 people. By training the leaders and also training the mid-level and lower-level health workers, we're very confident so that the ripple effect will continue for many years. On a typical day in a high-volume cataract program, we'll often restore sight to 200 people. And it's just so exciting just seeing the changes, and they recognize their children, their grandchildren. People often erupt into a spontaneous ululation. And the joy just comes through. There's no other concomitant eye disease. 90% of the patients will see well enough to pass the American driver's test the day after surgery. Patches come off, and it takes a couple of seconds to realize that they're seeing what they're seeing. And then there's this unbelievable smile.